The Charter of Patients' Rights and Responsibilities. My Health, My Rights, My NHS. Accessing and using NHS services in Scotland. I have the right to safe, effective, person-centred and sustainable care and treatment that is provided at the right time, in the right place and by the most appropriate person. Sustainable health and care services look to reduce waste and harm and distribute available resources to where they will deliver best value for the people we care for and for the health and care system. I have the right to be treated with respect and not to experience discrimination. I will be treated fairly and equally and will not be discriminated against, whatever my health needs and wherever I live in Scotland. My access to NHS services will never be affected or refused because of my age, disability, sex or sexuality, gender reassignment, marriage or civil partnership, pregnancy or maternity, race including colour, nationality, ethnic or national background, or religion or belief. See the Fairer Scotland duty at 1 below and the Equality Act 2010. I have the right to be treated with consideration, dignity and respect when accessing and using NHS services. My carers, family members and NHS staff also have this right. I understand I should treat NHS staff with consideration, dignity and respect when accessing and using NHS services. Health needs and preferences. My needs, preferences, culture, beliefs, values and level of understanding will be taken into account and respected when using NHS services. I have the right to ask those providing my care whether the care they suggest is right for me and if they can suggest any alternatives. I understand that, when considering my preferences, my health board must also consider the rights of other patients, clinical opinion, and the most efficient way to use NHS resources. Cost of NHS services. I am entitled to most NHS services free of charge. This includes NHS services provided by GP practices, local pharmacies, hospitals or clinics, emergency services, and NHS eye and dental examinations. There are some exceptions to this. For example, I may have to pay for some services and items, such as dental treatment, in most cases, and glasses. In some cases, I can get help with these costs. I can find more on what support is available and who is entitled to help in the leaflets HCS1 and HCS2 on the Scottish Government website, www.gov.scot. Registering with a GP practice. I have a right to access a GP, and it is my responsibility to register with a GP. I should contact my local GP practice to find out more. The following link has information about access to healthcare: www.healthliteracyplace.org.uk/toolkit/access-to-healthcare. I understand that sometimes I may not be able to register with the GP practice I prefer. For example, when the practice isn't accepting new patients, or if I live outside the area the practice covers. If this happens, my health board or NHS National Services Scotland will find me another practice in my area. My local GP practice will usually be the first and main point of contact for general medical services, including services provided in my local community and, where appropriate, referrals for hospital treatment. My GP will help me to see the right person at the right place and the right time, and support me to look after my health and well-being. I can tell my GP practice if I would prefer to see a particular doctor. The practice will do their best to try and meet any reasonable requests. A GP practice can remove me from their register in some situations. For example, if I move out of the practice area, or if I am physically or verbally abusive to people at the practice. I can find out more about removal from a GP register on NHS National Services Scotland website, www.nhs.nhs.scots/medical-services/patient-registration-and-medical-records/how-to-remove-patients/. Registering with an NHS dentist. To receive the full range of dental treatments and care under the NHS, you must be registered with a dentist providing NHS dental treatment. When you register with a dentist, you will be registered for life, unless you or your dentist asks that your registration is withdrawn. Your dentist must give you at least 3 months' notice if they want to withdraw your registration if you are an NHS patient. The dentist can withdraw your registration immediately if you are violent, abusive, or repeatedly miss appointments. If you attend another dentist for treatment and don't tell them you're registered elsewhere, your registration will automatically transfer to that dentist. Not all dentists will take on new NHS patients, so it's important to ask them if they're able to take you on as an NHS patient when you first contact them. Find a dentist near you. www.nhsinform.scot/Scotland's-service-directory/dental-services. If you need urgent dental treatment before you're able to register with a dental practice, you can get advice on how to access dental services at www.nhsinform.scot/care-support-and-rights/NHS-services/dental/emergencies. To register as a new patient, you will be asked for your name, address, date of birth and contact details. You will then be given an appointment for an examination. You will be asked to fill in a full medical history form before your appointment, and should take with you an up-to-date list of all medicines you are taking, if this applies. Once you have seen a dentist, you will be registered with the practice. At this stage, you should be given all the relevant information you need about your dentist, including the dental services they provide, who will be carrying out your dental treatment, and contact information and opening hours. If you want to register your child, you should do this at the same time as you register yourself. Remember, you don't have to wait until your child's teeth grow, but can register them soon after your child is born. You do not need to pay a deposit for an appointment to register. If it is not possible to register with my preferred NHS dentist, I can get information on other NHS dentists from my health board, or NHS Inform, Scotland's National Health Information Service. Appointments: GP, dental, optical, hospital or clinic, home visits. It is important that I make every effort to go to my appointments, as missed appointments can have a negative effect on other patients' care. If I know that I am unable to make my appointment, I should contact NHS staff beforehand to tell them that I will be late, or to cancel or rearrange the appointment to a time that suits me better. This means that they can offer the appointment to someone else who needs it. For home visits, I will try my best to make sure I am in at the agreed time. Another person can accompany me to the appointment to provide me with extra support. This can be a carer, family member, partner, friend, another healthcare worker, social care professional, or an advocate. A representative who helps me to express my views and make informed decisions. I may be able to get transport to a hospital or clinic appointment depending on my health condition. I can ask a member of NHS staff or my health board if I'm eligible for transport and for more information about the patient transport service. I can also find more information about this on the Scottish Ambulance website, www.scottishambulance's/services/support-with-appointments/ or by phoning 0300 123 1236. It is important to keep my contact information up to date and to correct any of my personal information that is inaccurate. I will tell the relevant NHS staff about any changes to information such as my address or phone number, or any other relevant changes about me, my health or my circumstances. This means that those involved in my care can easily contact me about my treatment, checkups or appointments and provide the most appropriate services for my needs. Using healthcare services responsibly. Using the right NHS service will help make sure I get the help I need and that all NHS services run efficiently. I can find the names, addresses, opening times and service details for thousands of NHS services in Scotland through my local health board or the NHS Inform website, www.nhsinform.scot. The following services are available for me to use when appropriate. Through my GP practice, I will normally be able to access a range of health professionals, including doctors and nurses, allied healthcare professionals, healthcare scientists and midwives who can provide routine treatment and medical advice for physical and mental health issues. NHS 24 can help me when my local GP practice is closed and I am too ill to wait until it opens. NHS 24 can also help me if I have a dental emergency when my dentist is closed. I can phone NHS 24 free phone on 111 for advice on physical problems or for mental health support for myself or someone else. If I use British Sign Language, Contact Scotland BSL, available 24 hours, can help me contact NHS 24. Find out how on their website at www.contactscotland-bsl.org. My local pharmacy can help me with a wide range of common conditions, including coughs and colds, sore throats, diarrhea and constipation, indigestion, aches and pains. They can also help me to stop smoking and provide emergency contraception. My NHS dentist can help with toothache, pain, swellings, injury to my mouth, and any ulcers or odd patches that don't go away after a couple of weeks. They can also give me general advice on oral hygiene. My optometrist can help with red or sticky eye, pain in or around the eye, sudden loss of vision, blurred or reduced vision, and flashes and floaters. If I am experiencing mental health distress, I can get support 24 hours a day by calling 111 and choosing the mental health hub from the voice prompts. I can also get support by contacting Breathing Space on 0800 838587 or by using web chat at www.breathingspace.scot. More advice to support mental well-being is available from NHS Inform at www.nhsinform.scot/healthy-living/mental-wellbeing. My local minor injuries unit can help with cuts and minor burns, sprains and strains, suspected broken bones or fractures. The NHS Inform website includes information on common symptoms and self-help. I can find information about NHS services in Scotland, including a directory of local services on the NHS Inform website, www.nhsinform.scot. Urgent and emergency care. I should only use accident and emergency departments, A&E, in cases of severe injury and in emergencies. If I have a medical emergency or someone else is seriously ill or injured, I should call 999 and ask for the ambulance service. The ambulance service will ask some questions to find out what has happened and arrange the most appropriate help for me. I can call 111 for any urgent health advice out of hours, including mental health, when my GP practice, dentist, pharmacy or other local services are closed. If I think I need A&E but it's not a critical emergency, I can call 111 before I go to A&E. This service is available 24 hours a day, 7 days a week. 111 will provide me with urgent care advice, and I will be assessed for a range of concerns, including cuts, burns, suspected broken bones, sprains and other injuries or illnesses. This may involve a telephone or video consultation with a clinician from my local health board, or an appointment to attend A&E or a minor injuries unit, avoiding a long wait at hospital. Medicines. My doctor or other qualified healthcare professional will prescribe medicines that are appropriate for me and will review them regularly. I have the right to be given all the information I need about my medicines, their possible side effects, and other options which may be available, in a way I can understand, including in Braille. www.gov.uk/guidance/medicines-packaging-labelling-and-information-leaflets #braille-on-labeling-and-pills. The Medicines in Scotland, What's the Right Treatment for Me booklet explains how I can work with NHS staff to decide whether I need a particular medicine and, if so, which one is right for me. It also tells me about the likely benefits and possible risks of medicines. I can find the booklet at the Healthcare Improvement Scotland (HIS) website, www.healthcareimprovementscotland.org. Or I can contact HIS direct on 0131 623 4300. I can ask for more information and speak to NHS staff if I am not sure how to take any medicines I have been given. I should order repeat prescriptions in plenty of time, and only order the items I continue to need. This will make sure my prescription is processed in time. It is important I take responsibility for my own treatment and care by doing the following: telling NHS staff about any medications I am taking, if I am receiving any care and treatment. Telling NHS staff if I have an allergy to any medicine, or if I have ever experienced any side effects from that medicine. Always finishing a treatment plan or course of treatment. I can speak to a healthcare professional involved in my care if I want to change or stop the treatment they have prescribed for me. Not taking prescription medicine that has not been prescribed for me. Not taking any medicine that is out of date. I can give any old or unused medicine to my pharmacist, who can dispose of it safely. Storing medicines safely as directed and out of children's reach. Safe and effective care and treatment. I can expect that the treatment and care I receive is suitable for me and my needs, is carried out in line with the law and is based on recognised clinical guidance and standards. It will be provided in a way that is most appropriate for my needs, whether face-to-face or otherwise, and aims to follow trauma-informed principles. In other words, helps to reduce distress and build trust. I have a right to expect that everyone working in the NHS has the appropriate skills and training for their job. The care and treatment I receive will be provided with reasonable care by properly qualified NHS staff. Health and cleanliness standards. I have the right to expect that the treatment and care I receive is provided as safely as possible, in an appropriate and clean environment. I expect healthcare premises to meet the standards of hygiene agreed by the NHS and Healthcare Improvement Scotland (HIS). Health boards, including HIS, or the Healthcare Environment Inspectorate (HEI), carry out safety and cleanliness inspections across NHS Scotland. I can raise any concerns about the safety, effectiveness or cleanliness of services that may affect my care with a member of NHS staff first, or with my local health board. I can find out about the Healthcare Environment Inspectorate and how to contact them through the Healthcare Improvement Scotland (HIS) website, www.healthcareimprovementscotland.org. or I can contact HIS direct on 0131 623 4300. Infection prevention and control. NHS staff should always wash their hands before they examine me. I can remind a member of staff to wash their hands before examining me if they have forgotten. I can help prevent the spread of infection in NHS premises by doing the following. Always washing and drying my hands and using the hand gel provided before entering a hospital ward. Always washing and drying my hands after using the toilet. Not visiting a patient in hospital if I am unwell, or if I am suffering from vomiting or diarrhoea, or anyone else in my household is. I should wait 48 hours after the vomiting or diarrhoea has stopped before visiting. I may be able to phone the ward and speak to the person instead. When visiting relatives and friends, I will follow the guidance and hygiene standards set by the hospital. I can also speak to NHS staff about how to support a patient in a hospital when visiting. Organ and tissue donation. I have the right to have my decision about organ and tissue donation respected after my death. I can register my decision to donate or not to donate on the NHS Organ Donor Register. This will make it easier for healthcare professionals to establish my wishes if I die in circumstances where I could be a potential donor. This means that I would not become a donor if I have made a decision to opt out of donation. Whatever I decide, I understand that it's important to share my decision with my loved ones. For more information or to join the NHS Organ Donor Register, I can phone 0300 123 2323 or visit www.organdonationscotland.org. Treatment time guarantee. I have the right to start receiving planned inpatient or day case treatment within 12 weeks of agreeing to it. This is called the treatment time guarantee. Some examples of treatments include hip or knee replacements or hernia surgery. If my treatment has not started within 12 weeks, my health board must explain the reasons for this and tell me where I can find information on the average waiting time for treatment. I may also be offered a cancellation appointment at short notice. My health board should take all reasonable steps to arrange for my treatment, which may be outside of the area my local health board covers. I will be told as soon as possible if I am likely to have to travel for treatment. In some situations, the waiting times may be adjusted if I cannot attend an appointment or refuse to. I should contact NHS staff beforehand to let them know I will be late, or to cancel or rearrange the appointment for a time that suits me better. A small number of treatments are not included in the treatment time guarantee. I can contact NHS staff to discuss whether my treatment is included in the treatment time guarantee. My health board will provide help so that I can easily access health services. Cancer waiting times. My health board should provide me with treatment within the following waiting time standards. If I am an adult with a newly diagnosed primary cancer, which is one of the 10 major cancer types, such as breast, lung, head and neck. Within 31 days from when the decision is made to treat my cancer until my first treatment, regardless of how I have been referred. Within 62 days from being referred urgently with suspected cancer, including referrals from national cancer screening programmes, until my first treatment. I can ask NHS staff if my cancer diagnosis is covered by the waiting time standard. In some situations, for example, if I am not available to attend an appointment, or there is a medical reason, such as an infection, or I am waiting for a wound to heal, my waiting time may need to be adjusted. Mental health waiting times. If I have a mental health problem that requires support through specialist services, my health board should provide me with treatment with the following timescales. %90 of those referred to Child and Adolescent Mental Health Services, CAMHS, should begin treatment within 18 weeks of being referred. %90 of people referred for psychological therapies should begin treatment within 18 weeks of being referred. In some circumstances, my waiting time may need to be adjusted. For example, if I am not available to attend an appointment or choose to delay treatment. I can find more information about treatment times on the NHS Inform website, www.nhsinform.scot, and from Treatment Time Guarantee Guidance and NHS Scotland Waiting Time Guidance on the Scottish Government Health and Social Care Directorate's website, www.sehd.scot.nhs.uk. Treatment abroad. I should discuss all my options with my local health board to find out if it is possible to have treatment overseas, as a number of conditions apply. I can find out more about my right to go to other countries outside the UK for treatment on the NHS Inform website, www.nhsinform.scot. Overseas visitors and UK nationals living abroad. If I am visiting Scotland from overseas and need treatment during my stay, NHS staff may ask me to provide health insurance documents. I understand that I may have to pay for certain NHS services. If I need hospital, inpatient or specialist treatment, I will have to pay for it, unless I am exempt from charges as agreed with the hospital providing the treatment. If I need emergency treatment in A&E, I will not have to pay for it. If I need general medical services provided by a GP practice, I will not have to pay for them. I can find more about rights when visiting Scotland from overseas on the NHS Inform website, www.nhsinform.scot, or by phoning the NHS Inform helpline on 0800 224488. Asylum seekers and refugees. If I am an asylum seeker or a refugee living in Scotland, I have the right to NHS healthcare while I am here. If I am seeking asylum but don't receive support from the Home Office, or I have been refused asylum, my healthcare will still be free while I am in Scotland. I can find out more about my rights to access NHS healthcare on the NHS Inform website. www.nhsinform.scot/care-rights/health-rights/access/health-rights/and-asylum-seekers, or by phoning the NHS Inform helpline on 0800 22 4488.